Hello and welcome. Today I'll be talking to you about the causes of neck pain. What are the causes of neck pain? From time to time, we do experience some form of neck pain. A number of times, just benign, nothing to worry about. But other times, we need to take very definite steps to preventing very serious problems. Now, I'm going to categorize the causes of neck pain into a number of subheadings. Number one, I'll be talking about positional causes of neck pain. Now, when we say positional, it means the place where you place your neck, if you get what I mean, could actually determine whether you develop neck pain or not. Now, a number of times we spend a lot of time on our phones. Now, we hold our phones in this way and we keep on doing so many things in our phones with our head positioned this way without realizing the fact that we're putting a lot of strain on our necks. And down the line, we begin to have neck pains and we're wondering, what did I do with my neck? A number of times, it's just simply about positioning, how you place your neck when you were using your phone, when you were watching the television, when you were using the computer over a long period of time. It's just basically strain on the ligaments, muscles in your neck. Now, at other times, it could also be due to the fact that you didn't sleep properly. Now, some of us just wake up only to realize that we didn't even know when we fell asleep. And if that happened to you, it's most likely you slept in a way that wasn't deliberate and so may not have used a pillow. Now, when you don't use a pillow, it's very difficult to get the right alignment to your neck. And so it's important that you pay attention to how you sleep. Be sure that you are about to sleep and then take a proper position. Otherwise, you wake up in the morning feeling the strain in your neck muscles, and sometimes the pain could be so severe that you could also have some neck stiffness. Number two, in terms of the categories, will be trauma. Of course, if we've had somebody hit our necks, we definitely will remember what happened. If we've had a fall previously, even if the fall didn't cause so much of pain at the time you fell, down the line you begin to have pains, and that could be a big problem. Now, if you've been sitting in a vehicle and somebody hits you from behind, you could have what is called a whiplash injury, where your head went backwards and then forwards. Now, you could feel the pain at that time, but down the line, you could have very, very protracted pain that will require treatment, and that could be a cause of neck pain. Number three, in terms of the categories, will be non-inflammatory causes of pain. Now, very importantly, osteoarthritis is a very important cause of non-inflammatory type pain in the neck. Now, when osteoarthritis occurs in joints outside the spine, we refer to that as osteoarthritis, which is a cartilage problem. And I've done a number of videos concerning osteoarthritis. I'm going to put a link down the line. Now, if you have osteoarthritis involving the neck, that is referred to as spondylosis. If you have arthritis involving the neck, it's called spondylosis. So when it occurs in the neck, we call it cervical spondylosis. And so this could be a major cause of neck pain for people, particularly as we get older. Secondly, if you've had a previous trauma. And then thirdly, if there are genetic factors. In other words, you're a female, you've got a mom that's got cervical spondylosis. Down the line, there's a possibility you could also develop cervical spondylosis. Same for males as well. Number four, inflammatory causes. Now, a major cause of neck pain could be rheumatoid arthritis. I'm also going to put a link for the videos for rheumatoid arthritis. Now, rheumatoid arthritis typically will involve the small joints of the hands, then the bigger joints, the shoulders, the elbows, and then the knees. However, it's important to mention that there's a particular part of the spine that rheumatoid arthritis tends to affect, which is the beginning of the spine, C1, C2. These are referred to as atlas, that's C1, that's the first cervical vertebrae, C2, second one. Now, what you need to understand is that rheumatoid arthritis can affect the cervical spine and cause what is referred to as atlantoaxial. Now, C1 is called atlas, C2 is called axial. So when you put the two together, it's atlantoaxial subluxation. Subluxation simply means a displacement. So when you have that occurring in patients that have rheumatoid arthritis, it's important to take note that they can have neck pain as well. Number two, another broad group of inflammatory disorders called spondyloarthropathy. I possibly will do a video concerning that, but this consists of a number of conditions from reactive arthritis, ankylosing spondylitis, enteropathic arthritis and psoriatic arthritis. Now, that's a very broad category of conditions that can present with inflammatory type pain and also cause neck pain. Now, number 5, infective causes. Primarily, a condition called meningitis. Now, meningitis simply means inflammation of the membrane surrounding the brain. Now, when that happens, they could present with very severe neck pain. Down the line, they could have stiffness of the neck. But in addition to the neck pain, this patient will also have fever and headache. So you have the triad of neck stiffness, number 2, headache, and then number 3, fever. If these 3 combinations are there, you're most likely dealing with meningitis, and it's important that you take very urgent steps to getting this patient to the hospital.